Of course, we're at this pivotal point here where we want to so-called plank the curve. And I want to bring in Toronto's Mayor, John Tory is with us now, because this, of course, goes right to some of the efforts that the biggest cities are making as well. Thanks for being with us, Mayor.
It's my pleasure, Amanda.
So we're getting these projections of, the difference between potential deaths versus, what we could do if we do our best here. Just catch us up on the latest that you're doing with the city to try to make sure people are staying out of the parks, staying out of, gatherings, and actually taking social isolation as seriously as they possibly can.
Well, our medical officer of health last weekend presented the numbers kind of in this general range, and some of them better and some of them worse to us. And we immediately asked her for a prescription as to what we could do as a city. And of course, in our complicated country, cities are limited in terms of some of the things they can do and can't do relative to provinces and to the federal government. So what we did in response to the projections of even a smaller number of deaths, I mean, it was horrifying, these numbers, was to move to much tighter self-isolation imposed in effect as a quarantine on people who are identified as having the virus, much stricter controls as to what we do with long-term care residences, and a host of matters like that, much more rigorous contact management, which is really what public health authorities do. That one's more under our own control to make sure that we follow up all the people that have been in contact with those who test positive. And then we've taken some other steps that are within our own jurisdiction, namely, for example, a bylaw that I brought in yesterday under the emergency powers to limit and to have a sanction put on people who fail to stay 2 meters away from each other, because it sounds in a way like an inconceivable kind of thing you'd have to do. But there were large numbers of people who continued, notwithstanding all the professional advice from the health experts, to be much too close to each other, whether it was in a park or whether it was walking down the street or in other places. And so now on our own properties, parks, squares, which is where a lot of the problem was with the nice weather happening around the country, in Toronto, we now say you can get a $750 ticket or more if you don't respect the physical distancing advice and requirements that we have given. So we've done everything that it is possible for a municipality to do in the country's biggest city to basically lock the city down. Now we're looking for some additional measures from the province to try and help us to do what we have to do to stop these lives from being taken in the kinds of numbers we've heard from Ontario today.
Well, let's talk about that, because when the province put out its list of essential businesses, essential services, it was a big one. I said at the time it might be easier to say which are not included because there were so many things on that list. You and I talked after that about construction workers still on the streets. There's a whole bunch of different places where it gets pretty complicated. How far should the province go? What else do you want to see?
Well, I would welcome a paring down of that list, because while I respect very much the fact that the Premier very thoughtfully looked at the supply chain, it's fine to say groceries and pharmacies are going to stay open to serve people as they must. But you then have to look beyond that to obviously figure out who supplies them and how does that all get transported around and so forth and so on. But I think the list in its early emanation was, very long. I think it had about 75 different categories of business on it and lots of companies underneath that. So I think there's some paring down there that can be done. If we're saying, look, we're now being told there's going to be thousands of deaths possible, I think what you do then is err on the side, obviously, of really paring that list down. And when it comes to construction, I think there are certain areas that are essential to continue with, such as healthcare itself and healthcare institutions, and maybe some elements of transportation, because people, again, have to get around. But I think there are also areas where you can say we'll take a pause for a period of time, recognizing that none of us in government want to put any more people out of work. I mean, there's lots of people, way too many out of work already from these compulsory shutdown measures. But at the same time, we have to place saving lives at the very top of the list. And I think that the contribution that additional measures can make to shortening the period of this agony and this trauma and saving lives will end up in the end causing less economic damage, so that we're better off to act now, take the pain now in a broader kind of way and deeper kind of way in return for getting a shorter period of trauma. We're saying in Toronto we put a 12-week program into effect with the full expectation that this is going to last 12 weeks and all the damage that entails to people and small businesses and big businesses, but that's going to be better than letting it go on for months and months more and having many more deaths.
How far can cities go to leave money in people's hands, which is obviously the quickest, best way to help people at times when their own income may be curtailed, including things like property tax holidays?
Well, a holiday implies that we're going to forgive it. Cities across the country, by and large, but certainly Toronto and all Ontario cities, face an obligation to budget a balanced budget. And I actually like that law because it forces a discipline us and makes us make choices. But we don't have the opportunity the other governments have, both in terms of the revenue sources that are much more varied at those other levels of government, income taxes, sales taxes, corporate taxes. We don't have those. And we have this obligation to produce a balanced budget. So I think our opportunity to have some tax deferrals, which we have done in Toronto and many other cities have too, is there. And we recognize that leaves cash in people's pockets. But I think in terms of the other measures, they've quite properly been taken. And I commend the federal government in particular for the things that it has done to put money in the pockets of individuals who have liquidity issues, also into the pockets of business people who have liquidity issues, obviously. But I think we're going to need more. And frankly, I'll say one more thing. I think before all this is said and done, if people are being honest, and I certainly am, municipalities are going to have some liquidity issues as well. We're losing, for example, in the city of Toronto alone, $20 million a week, which if you take this out over several months is hundreds of millions of dollars just from lost transit revenue because people are not taking the transit because they're not coming to work.
All right, that's a good point that you make. Of course, those are savings in people's pockets as well that we kind of have to factor into the mix of how people are faring right now. I want to ask you about another big story that is outside your jurisdiction, but boy, would it ever hit right where we all live. And that is this story of 3M being asked by the U.S. government not to ship protective gear, its masks, to partners like Canada. 3M appears to be resisting that. But how dangerous is it that if we see some essential goods blocked to our healthcare workers?
Well, first of all, it's contrary to, I guess, the spirit of the relationships we all have with each other, especially between our two countries. It's contrary to the spirit of free trade. And it also is kind of changing the rules in the middle of the game in the sense that you become accustomed, whether it's in the supply of personal protective equipment or other things, to an integrated supply chain. And when you have people just taking action to interrupt that, it obviously causes some issues. But I guess, we're working away in Toronto in full partnership with the provincial and federal governments, which really have the control over the procurement of personal protective equipment, PPE. And we've been prudent in the city of Toronto to make sure we've managed our own inventory. But, as this thing grows worse, and I think it's going to before it gets better, there's a trend line that, we seem to be on that shows the numbers getting, worse each day. And we're trying to manage that, obviously, with all these physical distancing requirements and lockdowns and so forth. It becomes something you have to keep a very close eye on. But we're working hand in hand with the other governments. And I will say cooperation in our case in Ontario and federally has been very good. And I think by and large across the country, it looks like it's been reasonably good. But this is a key area of concern, both to keep people well generally, but also, of course, to keep the frontline healthcare workers and shelter workers and so on well, because if they get sick, then we have a much bigger problem.
All right. Your Worship, we appreciate it. John Tory is the Mayor of Toronto. Thank you for your time today.
Thank you, Amanda.